Good afternoon and welcome to Selling Change, Vision, Trust, and Tactics for IT Executives, a health system CIO production. Little housekeeping before we get started. My name's Anthony Guerra. I'm the founder and editor-in-chief of Health System CIO, and I'll be your moderator today. We're looking forward to your participation. You can send in your questions or comments at any time in the Q&A box, and we'll take them later in the program. Just so you see how we're going to spend our time today, first we're going to go with our main panel discussion featuring Rob Adams, EVP and CIO at RWJ Barnabas Health, Jim Daly, VP and CIO at Washington Regional Medical System, Joy O, Chief Information and Digital Transformation Officer with the Christ Hospital Health Network, and Jordan Rook, CIO at AtlantiCare. And then we will have our Q&A. All right, let's jump right in. Rob, let's start with you. Can you give us an overview of your organization and your role?
Yeah, sure. So first, it's an honor to be here with you today. And then I'm working at RWJ Barnabas Health, which is the largest, most comprehensive academic health system in New Jersey. We have about 44,000 coworkers. The system includes 12 acute care hospitals, 3 acute care children's hospitals, the state's largest behavioral health network, and our ambulatory network now is a little over 500 locations. We have a strategic partnership with Rutgers Medical School, which provides all their clinical research and activities, including the Cancer Institute in New Jersey. My role is as EVP and CIO is responsible for all IT initiatives and imperatives, including strategic planning, the technical leadership and vision, and then I direct the department's goals, policies, and practices, collaborating with our business and operational leaders throughout the system.
Excellent, very good. Thank you. Jim?
Hey everyone, I'm Jim Daly, CIO here at Washington Regional Medical Center in Fayetteville, Arkansas. We're a 425-bed hospital with 40 clinic locations. We're the region's only level 2 trauma center and comprehensive stroke center. And U.S. News and World Report has ranked us the #1 hospital in Arkansas for 4 consecutive years, so we're really proud about that. As a CIO here, responsible for, of course, all our technology infrastructure, applications, system interoperability, information security. We have a very robust PMO and service desk operation as well. And we're in the middle of a big Epic implementation. So that's my focus for the time being. But beyond that, making sure that we have a solid strategic roadmap that takes advantage of emerging technologies and innovations to assist our caregivers.
Excellent. Very good, Jim. Thank you. Joy?
Good afternoon. I'm glad to be here. So I am a Chief Information and Digital Transformation Officer at Christ Hospital Health Network. This is actually a new role where, the emphasis is really placed on digital transformation. This is a 130-year-old organization in Southwest Cincinnati, and really just looking to, see how can we take things to the next level in terms of innovation and delivering, better new ways of care, improving, the efficiency of our clinicians and so forth. So we are a 2-hospital health system with additional AOCs and physician offices. We are, been one of the first organizations on Epic. So that's, that's always been a very interesting thing to try to figure out how do we really optimize our systems. But just a really good place. We're nationally ranked often as one of the best organizations for cardiology, consistently rated as one of the best health systems in Cincinnati. And so it's joined there in October. So it's been a lot of fun, a whirlwind.
Excellent. Thank you, Joy. Jordan?
Sure. Thanks, Anthony. I'm Jordan Ruck. I am the CIO at AtlantiCare. We are Southern New Jersey's largest health system and the largest non-casino employer. We serve our community across 110 locations. As CIO, I'm all about connecting technology to our mission. We have a big focus here on being the first health system to have a single platform for our EHR and ERP across the board. So that's part of our partnership with Oracle. Looking forward to the conversation today.
All right, very good. Let's jump right in. Let's start with the fundamentals. When you're introducing a significant change, whether it's a new clinical system, a digital front door, or a back end infrastructure overhaul, what's your first step in selling the vision internally? And how do you tailor the message about a change initiative depending on the audience, whether it's clinical leadership, the C-suite, frontline staff, or board members? Rob, let's start with you.
You know, when you have a last name like Adamson, you're always prepared to go first. It always seems to go that way. So the way to answer this question for us is selling it sounds like you need to convince people you don't have a standing relationship with. So one of the things that we did at RWJ is an exercise about awareness. And we actually asked the entire IT team, go through all of your meetings and let's categorize them as early, mid, and late awareness. And what we found was about 80% of our meetings were late awareness. And so what we did strategically is change that to early awareness. Things like being on the board of trustees or the board of directors, or you now at the COO council. All of those things means you're at the tip of the spear and you're actually there when those decisions are being made and being part of the strategic vision of the health system. By doing it that way, the selling doesn't really have to happen. You're actually having an exchange between one executive to the other because your positioning is in such a way as you're an equal partner in terms of the executive team. So the way we do this is by positioning this, and that simple exercise of moving from the late cycle to the early cycle has decreased selling and making some of these things much easier than they used to be.
All right, great. Good point. Jim?
Yeah, I think, thinking about fundamentals, never underestimate the value of relationships. Spend the time to learn the motivations and needs of your executive team and board members. Making sure that you have that understanding helps you tailor the messaging as appropriate, because everybody has their different point of view, a different perspective, a different why. And so at selling that vision is making sure that you can address each of those needs. Tailoring the needs to each stakeholder and focusing on the why is also very important. I think too many times we overlook why we're trying to solve the problem. We don't define the problem well enough. Taking the time to do that really saves a lot of time and energy on the back end of getting these initiatives moving forward and approved.
Very good. Joy?
Yes. Oh gosh, so many thoughts on this, but I do agree that it has with what Jim says, it starts with the relationships. I remember really early on in my career, I learned from a mentor of mine, he said, by the time you get to a big meeting, um, nothing should be a surprise, right? If you're presenting a proposal or an idea, right, or asking for a decision, you should have already had those conversations with everybody you need to beforehand and make sure you had alignment. I'm like, that sounds like a lot of work, but he was absolutely right. So I think that's key. And then I think what is really important in bringing about change is we're all leaders here. You have to have your team behind you and your team believing in the change. Because if I'm the only one out there trying to bring about this change, my team is like behind my back saying, we don't get it. We can't do it. Right. I mean, that's going to show. And it's also not going to cause that change to actually occur. So I think, focusing too much outward on the lateral relationships and the upper and then not thinking about your team who's actually so key to bringing about this change in a positive way, I think can often lead to not being as effective as possible. And I think the last thing I would say in regards to this is you can't argue with data. And so I think in my last 3 organizations we had to completely redo the IT governance, and that's a change that nobody ever likes. But the way we sold it was just showing them the data. We said, this is how much capacity IT has. Here's the numbers of how many projects we can get done. This is how many you all are asking us for, right? You just can't argue with the data, right? So together, how can we solve this and put together a system where we can make sure we prioritize the highest, value projects that are aligned to our strategic goals. So I think, once you kind of take the emotion and the subjectivity out of it, a lot of times change can become, in my opinion, a little bit easier to swallow.
Quick follow-up, Joy. You mentioned sort of a concept of like a sequence. And first, you want to make sure your team's on board behind you. We have a question sort of on this a little later, but the idea, how do you know? How do you know if the team's with you? And I would assume it's important not to mistake silence for agreement, right?
Yeah, yeah. I mean, I think some of it is you can tell, and that's why I think living in this remote, a lot of times this remote hybrid world is a little bit more challenging as a leader. You have to have, I think, a little bit of a higher EQ. But I do think, you could just tell in terms of you ask your team to do something and you don't have to keep following up with them for it, right? They'll do it, or they'll come to you and say, hey, I was thinking about this project, and how about we do this? Like actually being innovative and excitement, right? And kind of going above and beyond and going the extra mile. I think that all goes a long way. If I start to hear my team kind of repeating the things that I'm saying, right, as they talk with their teams. But again, I think that all involves me being, in touch and in tune with my team to be able to observe, right, what are the things that they're saying, kind of what are the things that they're not saying with their mouths, but they're saying with their bodies, right? I think all of that is really important. And, it's not enough, and I'm sure my colleagues will agree, it's not enough just to be good technically anymore. To be a good IT leader, you have to be really good at relationships, reading people, understanding and, getting folks motivated and kind of all of that fun stuff.
Excellent, excellent points, Joy. Jordan, your thoughts?
Yeah, thanks, Anthony. I totally agree with Jim and Joy, mentioning the relationships and the why and the data. I tend to go to beginning with clarity of purpose. So, why the change matters for patients, why it matters for the staff, why it matters for the community. Because if people don't believe in the purpose, they're not going to buy into the process. The other thing I'd add is engaging the clinical and operational leaders early to co-create the vision is key. So I've learned that co-creation beats any other strategy. People support what they help shape. 9 times out of 10, you'll be successful if you've kind of co-created that vision with other clinical and operational leaders in the organization.
Yeah, that's a great one. I think Rob touched on that sort of in a sense about getting ahead, getting at the tip of the spear, um, co-creation. And what about engagement, Jordan? What about, you want to do that co-creation? It can be challenging sometimes to get clinical leaders, operational leaders to engage, even though it's in their best interest and things are going to work out better. They're so busy, right? They're sort of never stops on that end. You have any advice on how to get them to be a part of that early co-development?
Yeah, that's a great point. We have value analysis committees here at Atlantic Care that are co-chaired by our clinical leaders as well as our administrative leaders. So we have time set aside where we talk about those programs that are coming up and debate what our priorities are. So we know we have buy-in before we even start the work.
Okay, great. Yeah, lots of great stuff in there.
Anthony, one other
Yes,
thing to
go ahead, Rob.
consider in terms of getting buy-in, one of the things we've been successful at is having shared incent goals between our operational leaders and our IT leaders. That's made a dramatic change because when you sit down and say, these are the goals of your department, this is the goals of IT, we're going to share the exact same goals. It is amazing how the projects all get done. The scoping gets done differently as soon as you align those incentives. And so that's something we've done universally this year. So each one of our executives has a shared goal with their counterpart in operations and then with themselves as well.
And these goals, Rob, are they linked to reimbursement? So bonuses and these type of things when you say goals?
So it can be both. So there are incentive goals and non-incentive goals. Some are just, these are the goals we're going to do that are tied to the strategic plan of the health system. And then some of them are their incentive goals as executives. Each one of them has incentive goals.
Mm-hmm.
And so one of the ideas we put forward to the system is we wanted to share with our operational leader. That was voluntary this year, and next year it'll be mandatory that all operational leaders start sharing goals amongst themselves. But IT is now doing that with our operational leaders, and now our projects are getting done a lot faster.
Hmm.
And when we, to Jordan's point of co-creation and things like that, that's where the success metrics are made. That's where all the things are going to be made that says, listen, what does great look like when this project is over? The time to have that discussion is obviously in advance of that. And then having them incented this way has created an immense amount of collaboration.
That's really interesting, Rob. Has that been going on for a while?
So we've been doing that for the last year with that model. And then the previous year was amongst ourselves in IT, having all shared goals. So with the operational leaders, one thing that has also happened is because we have these incentives, there's now forced touch points that also gives us more strategic vision and insight into some of the service lines, which we previously didn't have, and now we have pretty seamlessly.
Very interesting. Very good. All right, Jim, we're going to start with you on this question. Trust is often cited as the currency of leadership. What are some of the ways you've intentionally built trust with clinical and operational leaders, especially before a major initiative begins? Although some of the nuance in this question is the theory that you don't want to wait until you're about to start a project. Like
Yeah.
it should be right because then it's very transparent. Like, oh, Jim never asked me out for coffee, and all of a sudden he wants to be my best friend. Um, how much of your success?
You've heard about that approach, huh?
Yeah. How much of your success in change leadership is tied to personal credibility? I'm assuming quite a bit. And what can an incoming or newly promoted IT executive do to accelerate that trust building process? Obviously, Joy, having started fairly recently, will have some thoughts on that. But Jim, what are your thoughts there?
Yeah, I think again, it's all about investing time with those leaders, and it's easy to underestimate the value of listening to your stakeholders and peer group. And I think when you listen and can give feedback and demonstrate that you understand the challenges that they're going through, then you start to build that trust and relationships, because folks then have the feeling that, okay, Jim really gets me and understands my challenges and really going to do something about it. To that end, following up and delivering, even if you're chipping away at low hanging fruit on behalf of your stakeholder, customer, partner, helps build that credibility. And some folks tend to think that you can just walk in a room and give them your resume and your experience, and then you should trust me that I have credibility. But folks have to see results. I mean, your credibility and trust is based on outcomes and your ability to get the work done. People, your team, Joy mentioned, has to believe in you. So you have credibility with your team. That takes time to build that trust. But having the trust of the executive stakeholders, the board, the folks that are going to trust you to deliver, say, anything from a transformational effort to a small project that will drive, improvements in patient care, is just critical in the CIO and leadership role.
Hey, Jim, have you ever had the experience where you're trying to engage with an operational clinical leader and they're bringing you issues that are sort of way below the conversation you're trying to have, like this plug doesn't work or something, and you're like, yeah, that's kind of not really what I'm here to chat about. Although if you're super dismissive of that, then they're just annoyed with that too. So it's almost like you got to acknowledge it, say you'll have someone look into it, but here's what I actually also want to talk about. Does that make sense?
Totally. And I think awareness of agendas are important. That could be a test. If Jim is going to pay attention to the small things and make sure those are taken care of, then yeah, I've got a little bit of confidence that Jim may be able to take care of the big things. And so that's really what I mean by low hanging fruit. So, when I came on board Washington Regional, I did spend a lot of time with our director, VPs, executive team to really understand them. And yeah, I did, I'm talking about, or my agenda is, high level strategy and, market presence and things like that. And they want to talk about, well, the computer for one of my analysts is broken.
Right.
And it's like, okay, well, that is very important. Everybody needs to be productive. So let me make sure our team gets on that and gets that done. And then you follow up with that. And, it seems, small in the grand scheme of things, but don't underestimate the value of, incrementally delivering value wherever that value may be.
Absolutely. Yeah, to be too dismissive of that stuff and act like it's beneath you, that's not going to help things. So, Joy, your thoughts?
Yeah, no, I would have to agree. It's about like doing what you say you're going to do, right? If I listen and I say all the right things and I kind of nod sympathetically and then I go away and they don't hear from me in 6 months, right? And they have to follow up constantly, that's not going to build trust. And so, I'd much rather say, okay, I can deliver this thing. It's going to be small, but at least I can deliver this. And if I can't, it's about getting back very quickly and saying you can't, right? I think sometimes, and it's kind of human nature. If a project's not going well or you're going to be delayed, you kind of want to figure it out and hope nobody notices. But the fact is everybody will notice. And so it's much better to say, hey, this is the situation, we're going to try to resolve it as soon as we can, let's work through it together. And so I think really that kind of, um, almost sometimes painful transparency and honesty, I think goes a long way in building trust, because now hopefully people will know that, hey, when Joy says something, she means it, right? Whether it's good or bad. And I think that goes a long way in just establishing trust.
I think that's such a good point. I think people sometimes have a tendency to be working on it, but not communicate that they're working on it. So the person that's waiting for a response doesn't think you're working on it. And I've even had where I'm trying to deal with people, and after multiple outreach, they're not responding at all. And when they finally do respond, it's, oh, yeah, I've been working on that. Well, why couldn't you let me know you were working on that? Because I'm just getting more and more irritated. So ignoring you see what I'm saying? And it's a great point. Jordan, your thoughts?
Yeah, I agree with everything that's been said. I think in my experience, true leaders consistently operate with transparency, even in the face of challenges. So as you mentioned in the question, particularly when navigating a major initiative, it's important to build trust in the quiet moments, before the big decisions are needed, before you need to rally for support. It's in those quiet early stages where trust is built. So I make it a point to communicate openly about the risks and the unknowns and the trade-offs way ahead of time before a major initiative launches. And I think that helps create a foundation of credibility that pays dividends down the road, because we've all been through big transformations and there's always going to be things that go right and things that don't go right. You're going to need to reach into that well. You're going to need that alignment and that momentum down the road. So taking advantage of those quiet periods to build up that trust bank.
Yeah, and Jordan, a quick follow-up before I go to Rob. Transparency has to be operationalized. Transparency has to have a process behind it. And what I thought about when you mentioned this was, sometimes you go to a restaurant and it's an open kitchen. You can see everything going on. And then, not that you know exactly what's going on, which dish is yours or whatever, but the point is, you could see it. You can look up and see what's going on. So transparency needs a methodology, right? So what are your thoughts around that?
Yeah, I think that's right. And I think if you use that kitchen analogy, every organization has those, everyone knows this is a broken system pain points, like a clunky IT intake process
Right.
or a security review process that takes, too long. And most of the leaders in the organization roll their eyes when they think about those processes. So I think one of the things that I'd advise other leaders to do is focus on that. Think about those processes that feel like black holes to the customer and make it a priority to fix it. And, you'll show your clinical and operational leaders that their voice matters, that their time matters, and you'll be able to accelerate that process to build trust. Tackle
Yeah.
those things that everyone knows are a problem.
Yeah. And the more you can sort of, again, automate that, make it a process, then it can just exist on its own. They don't have to request a view. They can just get the view, right?
That's
They can see where it is in the system. To me, that would be ideal. Rob, what are your thoughts?
Yeah, thanks. So I agree with everyone, because I sum it up in 3 words too that you've all said. One is transparency, then consistency, and the one I'm going to focus on is empathy. And the reason I say that is because if they know what your values are and you have shared values, it's very easy to begin to rally and trust. The example I'll give you is when people think of an electronic health record being converted from one to another, they think of it as a technical conversion. When we did it at RWJ, we called it a patient safety event. And that resonated throughout the entire health system, so much so that when we were huddling during an activation, everybody had to declare as we went around every single facility, our patients are safe. And so what happened was all the clinicians now think of the technical team as a patient safety advocate, which is very different. And then they know that the value of our system and the value of our group is aligned with what they are, because the vast majority of the people that we're working with are patient safety advocates. And so our trust has gone up dramatically because we empathize with who is our customer. Who is our customer? Could be our patient, our family, our communities, each other. All of those things make the trust accelerate when you know you have shared values. And so that would be an example of how we use empathy, and we use it in many other ways, but I think the transparency is critical, the consistency that Joy talked about, but I think being empathetic also makes it much easier to do.
You know, Rob, I've heard it said, in many ways, especially around cybersecurity and all these things about IT being part of patient safety, but the term you use, the patient safety, we are patient safety advocates, that to me like really resonates. And if you can sell that, like if you can sell that to where the organization truly believes that the IT department are first and foremost patient safety advocates, that's effective to me. Like that really, it sounds right.
Because what you want is not to be advocating for yourself while you're with them. You want them to advocate for us when you're not with them. And so when you make it a patient safety event and when you have patient advocacy and safety advocacy, it's now gotten to the point where I just had a CEO literally tell me about 4 weeks ago, I know that would never happen. They could have never agreed to that because that's a patient safety issue. And I know that IT would never have agreed to that. And the answer was we didn't agree to that. It was an urban legend that was going on, but we had somebody advocating for us while we weren't even in the room.
Very good. All right, excellent. Let's go to our next question. Okay. Well, how do you recover when trust is eroded? Not everything's going to go great every time, as much as we want it to. So, projects is going to fail. Even, we want to be transparent, but things will not always go well. There'll be missteps. Sometimes they're not yours. Sometimes they've happened before you arrived. Sometimes the ID department has a poor reputation. Sometimes that's why there's been turnover. Sometimes not. But I guess it's the same steps as building it in the first place, or are there any more nuances to when you do have when you have had an issue? Joy, we're going to go with you first.
Yeah, I think, one, recognizing that the issues are going to occur, right? And I think that's important for me to also reiterate to my team, because I found that sometimes they will hide things if they don't think that you're going to just, it's that whole just culture thing, right? So I think one, acknowledging that they'll occur, but two, I think it's so important to show that, after the fact, we as an organization, we're going to analyze what went wrong and then try to prevent it from occurring in the future, right? I think the frustration occurs when, there's outage after outage after outage, right? Or delayed project that just, and it's just like, just a really bad Groundhog's Day thing going on, right? It's showing like, okay, we're going to own up to this, but, this is what we've figured out is the root cause. And this is what we're doing to try to improve it. It might not be perfect, but, and then bringing about that change and, sometimes celebrating your victories, celebrating the improvements. I think that that really helps, because it's going to occur. You're never going to be able to avoid it, especially I think in technology. There's just always unknowns. We're dealing with so many third parties now as well, that there's just some things that are going to be out of our control anyway.
Very good, Jordan.
Yeah, I think if there is a missed deadline or an organizational misstep, the first thing is it's good if you could be the one to deliver that message and to deliver the mitigation plan and to know the background, know the details. And, instead of answering the question on, why was this milestone missed or why is this project off track, be the one to bring it to the table, be the one to know what the mitigation plan is, be the one to know what the impact's going to be before you're answering questions. But when trust does take a hit, the first step is to own it clearly, publicly, no deflections, just honesty about what went wrong and what could have been done better. And only then can you open the door to have a real dialogue. Then you can bring your stakeholders back and, as I said before, help them co-create the fix. And that can also help shift the vibe a bit from blame to progress. But, trying to get ahead of it, I think, is what we are all about as leaders in IT, trying to almost see when those issues are going to arise and be the ones to bring it to everyone's attention and show that you've already thought about it and have a plan to address it.
Yeah, Jordan, it's that proactive approach, right, to fixing problems, and it reminds me what we often hear about. Uh, Nobody wants to be surprised. So as as you're dealing with the people who report to you, one of the things that we often hear leaders telling people who work for them is, bring me the bad. I don't want to be surprised, right? Bring me the problems ahead of time or the issues I don't want to be surprised. And it's the same thing that people that you report to, the people above you, they don't want to be surprised. Nobody wants to be surprised,
100%.
right? So the more you're proactive in every which way, as you said, own the problem, find the problem, present a solution to the problem, and don't wait for those things to be requested of you, right? To your point. So great stuff. Um, Jim, your thoughts?
Yeah, I'll come at this at a little different angle. I mean, that all the comments are great in terms of addressing your stakeholders. I think it's important that when trust is eroded, to make sure that your team's taken care of. What we say quite often here is, it's not that a mistake was made, it's how you recover from it is
Yep.
what's important. So try not to dwell on the issue, the mistake, and focus on how we're going to correct it, whether it's an improved process or additional training, because we don't want a bunch of folks running around afraid to press the button and do their job because they're going to make a mistake. So I think honesty is very important there, and passing along the feedback, the direct feedback that you get from stakeholders to your team. So, I completely agree and in alignment with trying to take that bullet for the team. However, taking that first blow and then figuring out the right way to approach it with your staff so that you're building confidence, you're showing trust in them, and that that they can overcome is just critical to having your team trust you and be able to rally, when it's important.
Yep. Rob, your thoughts?
Yeah, I mean, all the points are all the things I believe in, and so they're really well done. That my dad used to always say, when the team does well, stand in the corner and take the picture with them. When this happens, tell them to sit down and take the picture alone. And when you sit there and you get to the head of the line, they all know that, don't worry, we have each other's back. The other thing is to remind everyone that how you deal with adversity and failure is actually disproportionate in terms of your growth as a leader. Typically, in good times, you learn things iteratively. It's when you have one of these things where you go through a root cause analysis or a change in governance or a mitigation, all the good points everybody's brought up. To me, when these things do happen, is rather than dwell on the failure, think of the opportunity you've just been given to show people how you can recover from these things. And so when you couch it in the sense that this is a growth opportunity, that we're all going to get better together, and their leader has their back, it becomes something that you just rally around in unified purpose.
Very good. So when we have a problem, we have a failure, we have a mistake, it's a sequence thing here. The first thing we want to do is address that as well as we can, given the situation. We want to address the problem, right? Let's fix the problem as a team, whatever. And then we want to do that root cause analysis that everyone has touched on. So we fixed the problem. We try and go back and figure out why the problem happened. And then to me, the closing the loop is fixing the process, right? Because there was a process theoretically that resulted in a problem. Could have been a one-off and maybe the process is fine, but we need to do that analysis. Could be we need to tweak the process. If we don't do that last step, Jordan, we really haven't gotten anywhere. What are your thoughts?
Yeah, I agree with that. I think that closing the loop and making sure that you have the process to measure that it's truly been solved and have regular check-ins even after the issue's been resolved is also important. So I think a lot of times we do a pretty good job communicating known changes ahead of time. I think where a lot of organizations could use some kind of communication experts to come in and help us is after those programs are over and after we've kind of corrected and everything's live, keeping that communication up and keeping the organization engaged with, the initiative and why it's still important.
Mm-hmm. All right, very good. Next question. Rob, we're going to start with you on this. Many IT executives walk a fine line between persuasion and authority. How do you know when to push forward versus when to pause and re-engage stakeholders more deeply? We know the dynamic. We want to not have to tell anybody what to do. We want to have to, we sell it, and then everybody comes along and they're all excited. Yeah, sometimes that's a goal, but maybe not always. This concept of, you come with me, you turn around and not everybody's coming, and then you say, okay, do I go back and sell it again? At some point, do we say, hey, this is what you have to do. We're not discussing this anymore. Nobody likes to talk like that, but that's how things work in real life. I don't know. Your thoughts, Rob?
Well, I'm from North Jersey. I can always send somebody over and talk to them. We could do it that way, but that's probably not what we're looking for in terms of advice. All kidding aside, I think the thing that I would go back to is what is the positioning of IT in the organization? Because if it's persuasion, authority, follow-up and such, it depends on how you're positioned in the organization. So we worked very, very hard to ensure that, for instance, the highest functioning governance model in the health system is the Chief Operating Officer's Council. He only has 7 members on it: the chief nursing officer, chief health information officer, et cetera, and CIO. The reason that's important is because every one of these things are tied back to a strategic initiative for the health system. And we've also had the opportunity to then socialize the strategic plan of the IT division throughout the entire health system. So when I go to someone and say, hi, I just wanted to follow up with you on the strategic imperative. I'll be reporting this next week at the COO Council. I expect you can give me a summary by next week. The idea is you use your governance and your positioning to ensure that you get the right level of engagement rather than saying, you didn't do this, I don't want to follow up with you again. You just simply say, this is where it's going. I'm going to be presenting this at the board of directors when I do my monthly summary. I'd like to know, would you like me to include your information or not? And it's amazing. You get it overnight.
Mm-hmm.
So the idea is if you go back to the position and how you're going to advocate for your division throughout the health system, it makes this question something you can do and lean into that.
Rob, you mentioned that having the IT, the governance, being where you need to be in the governance framework is going to be very helpful. What if you're not? I mean, often the CIO can't affect the governance of IT. That's done at a higher level. What are your thoughts there?
Yeah, so what I would say is let's go back to how I had it. So when I first got here, the CIO wasn't on the board of directors, and we didn't have some of those things. It wasn't to impugn him, it's just the way we were structured at the time. And so what I needed to do is to make a pivot, which is to have a advocacy strategy to now go around and educate people. One of the things I would say to people is advocacy is an offensive sport. You can't wait for a CEO to call you into the office. You make an appointment with him or her. And so what I started to do is go around to all the CEOs at all the affiliates. Obviously, the COO is easy. That's who I report to, and the CEO of the health system. And you go in with your advocacy playbook to say, did you know this was our accomplishments? Did you know this is what happened in your own building and IT enabled all of those things? So you go in on an offensive, and then what happens is they say, hey, you should be part of senior management here at leadership. I'm like, it's funny you should mention. That's one of my asks for all of you. So the idea is if you wait for them to come to you, it's not going to happen. So be offensive. And so again, advocacy is an offensive sport.
Perfect. Thank you. Jim?
Yeah, I agree completely with what's been said already. I think governance is where you lean on and have facts and data, there to present. But I think, what I tell emerging leaders is the most important tool in your leadership toolbox is persuasive leadership and being able to build that consensus and advocacy organically. And, a lot of that is relationships, of course. So we've already talked considerably about that. But another piece is some self-awareness to make sure that you're checking yourself, and that, re-engaging with stakeholders to kind of reground what are we really trying to solve here and what are the outcomes, and then determine if, you need to take a more authoritative approach, or if, maybe conditions have changed where a modification of an approach or style is needed. And so I think, it can be really difficult to call that question to yourself and have that level of self-awareness. So I think having trusted advisors as well that you can lean on to ask opinions, perspectives, and lean on them for advice and guidance is important as well.
Very good, Joy.
So I think there's a couple different scenarios that come to mind when I think about this. So one is, I think sometimes you have to understand why somebody's not following what you think is like the best, most awesome Uber plan ever, right? And I think a classic example that we've never experienced, of course, is shadow IT. And
Yeah.
What's
it's
that?
especially,
I never
yeah,
heard
right.
of that.
And it's like
Okay.
you come into a new organization, especially, and you're like, oh my gosh, there's all these departments that are doing IT. I need to like gather them all in under me, right? This is just not how it should be.
Yeah.
But I learned that I needed to stop, like, I've been guilty of this too, right? I need to stop and like ask, why has the shadow IT been developed, right? Is it because the IT department wasn't able to provide for their needs in some reason, right? Whether it's from a technology standpoint or a skill set, right? And then have that conversation. Or is it because we didn't have a good enough understanding of, say, the data to be able to be productive, right? If the shadow IT is something more of a like a reporting or analytics capability. And so I think, understanding why somebody's trying to understand why they're not following along, I think is really important. Now, if somebody's not following along to a plan that has been approved, and has had, kind of everybody stacking hands and agreed to, I think that's always going to be, that's just always going to be a situation that occurs. But I think if it's kind of like the whole hype cycle, right? If you have enough of people on board, there's just going to be a few that, I mean, they're either going to be left behind, or they're going to be like, okay, I need to get on board with this train because it's leaving, right? And so I guess I typically don't like to spend too much time trying to kind of win over, convince like the 10% that's there with their heels dug in for a reason that I can't figure out, after I've tried, and really focus on like the 90% of people who are excited and kind of want to go on this journey together. Because again, sometimes there's just grumpy people.
Yeah. And
I'm
Joy,
just gonna say it,
yeah. And
Uh,
you have to
Um,
decide, can I leave that 10% without it being a problem, right?
Of
Can I
course.
just leave it, or do I need to deal with it, or some of it, right?
Right. If it's like the CFO, right? Yeah, then I probably can't just leave it because I'm not going to get any funding.
Hmm.
Um, but again, if you're talking about like say, clinical, stakeholders and, all but just a couple of them are, kind of bought in and you've tried, again, it's like, I know that if I keep trying, it's not going to affect the change because somebody's
Yeah.
just decided not to, participate. And so it's like, I'm not going to ignore the other folks that are excited or my team that needs me to spend, just an excessive amount of time on somebody who's clearly just not, who's decided not to engage.
Yeah, and Joy, to your point, before I go to Jordan, I have had this conversation with other CIOs about the shadow IT, where they ultimately spoke to the department about sort of assuming some of the IT related work the department had been doing. And the department was like, yeah, we don't want to do this. We've been doing it because centralized IT couldn't get anything done for us. So we're happy to give this to you.
Right.
So sometimes it's the answer sort of you want, and you're like, yeah, that works out for everyone. Jordan, your thoughts?
Yeah. And all of a sudden there's 50 new people in your building the next, which is, yeah, I think there's a thread here that I want to explore a little bit between leveraging authority and, versus persuasion and what impact that may have on trust and credibility. So I think being part, as Rob mentioned, being part of the senior team is important. Having representation at the board level is really important. But I do think there's a distinction between leveraging that authority and using persuasion to, end up where you know the organization needs to go. So I think if you're resorting to authority, in many cases, at least to me, it's a signal that you're off track. I find persuasion is usually the way to go. And I think, as Joy mentioned, in my experience as well, when team members are hesitating, there's probably a good reason. There might be something that you don't fully have your hands around. Digging into their concerns can keep everyone aligned and keep trust intact instead of, falling back on authority.
Jordan, does that ever hit? I mean, does that ever stop working? I mean, listen. Then let me give you an example. I was interviewing Eric Decker, as CISO at Intermountain, or I was speaking to him or listening to him, and they did this major overhaul from on a security point of view, from their architecture and all that. And at some point, he says, this is not a choice. This is happening. Like he did the whole persuasion, he did the whole selling thing, and then it was, hey, this is what we're doing now. Whether or not the whole dynamic Joy mentioned about a couple of people, I don't know if it mattered in that context. I don't know if they had to agree, because it was more of a technology change that just happened, as opposed to having to embrace a different process. But there is the other subtle issue of the bad apple spoiling the bunch, in a sense that you have a problem employee who, if you don't deal with that, that creates more of a problem. That's a dissatisfaction element to your other employees. What are your thoughts?
Yeah, 100%. I think if you're in that situation, it can create a lot of despondence in the team. And I think, don't get me wrong, if there is a situation and the data is clear, there's a patient safety issue or a compliance issue, there's no question. There is no persuasion versus authority in the equation at all. But in my experience, at least, if you have team members that are hesitating or team members that aren't on board, there's probably a good reason. Either they don't understand the plan, they weren't part of that co-creation, or maybe there's something that you're missing. A lot of people are in this business because they care about our patients and they care about our communities. And, I find more often than not, that's the case once you get down to the details.
Yeah, and I think your point about co-creation is right on. I mean, if you felt like you were part of, then you were invested in it. Why would you oppose something that you were a part of? So I think that's definitely can be very helpful. Let's go to my favorite section, our Ask a Co-Panelist, see what you all want to get feedback from each other on. Joy, I'm going to start with you. Do you have a question for one or more of your co-panelists? You can direct it to one individual or to everybody, and I'll sort of make up the order. It's up to you.
Yeah, I think, probably for people that are, kind of, seeing the webinar or going to see it later, sometimes I think it's intimidating, right, to see all of these CIOs that have kind of, made it this far in their career over these large organizations. So I guess, I would ask my peers if there's like a story or an anecdote they could share about something they've learned, right, and trying to bring about change, or in leading, where it's like, oh, if I could go back, I would do it differently, but this was the lesson that I'd learned, just to show that, like, we all started somewhere, right, as that analyst, or as that, kind of that programmer, and kind of had to learn, and sometimes there's bumps along the way.
I think that's a brilliant question, and let me throw Jim under the bus first, and then we'll go around
Thank you.
the horn.
Yeah, appreciate that. So yeah, you probably sense a theme in my comments that relationships are important. I think earlier in my career, that brute force authoritarian approach was one that I leaned on most. It seemed to get things moving faster, but what I realized is that it caused too much pain along the way, and that you're ending up extending timelines, losing people, degrading trust. And so shifting that approach, I think has really helped me understand how to be a better IT leader. And then I think on the staff side and my team, is making sure that you have that empathy that Rob talked about. I think that's super important, that they understand that you know how difficult their job is, that you know how hard it is to meet all of the expectations, all of the priorities, and balance that along with the non-work stuff that happens, whether it's getting kids to the games or making that anniversary date, those sorts of things that are critical to having a well-rounded leadership approach.
That's a great answer, Jim. Rob, your thoughts? Your story?
So I think where the empathy comes is for some who don't know, I didn't start my career in tech. So I'm a pharmacist by training, and I worked my way up to be the chief pharmacy officer of our health system, and then led an Epic project. And here we are as the CIO. And so I'm very, very sensitive to when a new application comes out and an analyst is unsure what to do, because I've already been there. I've already lived through that. The first time someone ever mentioned micro-segmentation to a server, I said, oh my God, what the heck is that? I better look that up tonight. That came up twice in the same meeting. The idea is that, showing them I can be vulnerable, and I know they're going to be vulnerable, and it's okay not to know, because there's a lot of times I don't know the answer. And I always tell them, I remind myself the first time I ever entered an ICU as a critical care pharmacist, knowing absolutely nothing. And then a year later, I was teaching ventilator settings. Well, I leaned on that experience to say, okay, I'm going to go into a brand new tech space, and it's my first year in the ICU, and just go back to those tenets. But it's going to be somebody's first day doing something, and never lose sight of that.
Yep, very good. Jordan.
Yeah, I think just listening to the comments, my instinct is to go back to some of my first steps. I've been here for about a year, and really one of the first things I did is go on a listening tour, and listen to the feedback, hear what's working, hear what's not working. But then before making any changes, just make sure that you are prioritizing that time to listen. And no one's expecting you to answer all the questions. And then take time to really also talk to your team, because it really starts with the team you have around you. I think trust starts there as well, by the way. Rebuilding trust within your own team has an extension out into the organization. And I think if you want trust in the organization, you have to have trust within your team. So I think, to Joy's point, really starting with your own team and building those relationships and building that trust among your coworkers is critical.
All right, great. I'm going to sneak one more in here, and then we're going to get going. But Jim, I'm going to give you the opportunity to ask your co-panelists a question.
Okay, I appreciate that. So, mentioned we're going through an epic transformation here. Change management, bringing folks along clearly is a priority. I'm wondering if my peers here have any suggestions on what are some commonly overlooked components of change management. Have you come across those after the fact? And I'd appreciate any advice you could give there.
Rob, let's start with you.
So one of the lessons learned, we went through an epic transformation. So first of all, congratulations. You'll get through it, and it's going to be amazing when you get to the end. One of the things we did with change management is, yes, we socialized things. What we could have done better is to say, here's what it looks like today. Here's what it's going to look like tomorrow. It's a lot of work to do that, but the investment is well worth it, because trying to just show them what's going to be in Epic now, they need some sort of anchoring context to know what they're doing currently in whatever system you happen to be in at the moment. And so one of the things is we did as much as we could with change management, but the feedback we got universally was, I really wish you would have showed me what does it look like today. Now, remember, you can't do every single one, but what you want to do is develop a taxonomy of what you would call high impact change, and then try to invest the time to say, here's what it currently looks like in terms of a workflow. This is what it's going to look like in Epic. And even better would be to say, here are the things we currently cannot do in this workflow, and here's the value that we're going to unlock with this change. The reason being is, if it's just change, then it's change. And to me, unless you give them the value of why we're doing it this way, 3 less clicks, we actually can connect these two. We don't have to fax anymore. Whatever it may be, it's the manual steps that we eliminate. But once you articulate the value and then you compare what you used to do to now, that would be something I wish I could go back and do better.
Brilliant. Thank you,
I'd
Rob.
love to add to that. I think
Yeah.
those are great points. And as I think back, I've also had a hand in leading an epic transformation
Well,
around change management.
we did it together, Jordan.
That's right. That's right. I remember it was.
Oh, you were there. That's right. Yeah.
A good time.
Yes.
But Jim, change management. My advice would be stick to foundation as much as possible. So on the Oracle side, for those listening that are on the Oracle side, stick to model. So Epic has foundation, Oracle has model. Don't take the approach of, well, how will this new tool work with our workflow, right? If you start to hear that said in the meetings, stop the conversation, because the conversation you want is look out to the market and adopt the best practice, and leverage others that have gone before you, and don't treat it as you start the meeting on with a big Excel spreadsheet on cell A1 and tell me how you do things today and we'll make the system work for you. Take model as much as possible, take foundation as much as possible. That's the key to unlocking a lot of the benefits of standardization down the road.
Cool. Yep.
Joy?
Yeah, I think, very similar to what Jordan was saying. I think it's important to recognize that like technology is not going to make up for bad processes or lack of process or inconsistent following of processes. And so I think sometimes, people shove in technology and they think it's going to solve all their problems, right? And world hunger and, make them a billionaire, but it's not, right? And so if you put in this big shiny toy and you haven't changed anything in terms of your behavior, it's not going to be a success, right? So I think to Jordan's point, it's like, okay, one, everyone has to be on board that we're going to try to, follow best practices, go to foundation as much as possible. But then it's like, two, how do we make sure we get everybody on board, right? So that we can standardize, because especially in healthcare, I think find that you get strong personalities. People are used to having, done things a certain way for a very, very long time. And so I think engaging, like, at the end of the day, it can't be like an IT project, right? It has to be this is your organization's name here project, right? And so it's just IT is just, kind of the key technical driver, but really it should be also co-owned with the operational leaders so that they're helping bring about that necessary change. If it's just seen as an IT project, then, when things don't go right, it's, it's you all that are going to be struggling. And sometimes it's not even a technology aspect of it that's causing the issue.
To Joy's point, one other thing, Jim, is your guiding principles need to say exactly what Joy just said. So if you create the guiding principles that say we will configure, not customize the system, and it has to be patient-centered only, and you can't do it in your case, I think it's a single hospital, but let's just say it's multiple hospitals. It has to work everywhere. It can't just work at the academic medical center or whoever the anchor hospital is in your system. So having guiding principles that plainly speak to that, and one that also Joyce said, which is this is operationally led and IT supported.
Excellent. Yeah, great insights. Thank you very much.
All right, that was wonderful. Unfortunately, we are out of time. Incredible conversation. Regarding continuing education, you can use the final slide in this deck. You'll get an email when the on-demand recording is ready for viewing. If you want to work with us, you can reach out to Nancy Wilcox if you want to sponsor an event. Go to our website to register for upcoming panels. With that, I want to thank our wonderful panel, Rob Adamson, Jim Daly, Joy O, and Jordan Rook. And I want to thank you for attending. And with that, everybody have a wonderful day. Thank you.
Take care. Bye.